laser eye surgery. I had LASEK surgery 7 weeks ago. So if you're considering surgery, this is what you'll need. Loads and loads of drops, which the clinic will give to you. Loads of these. You might need some of these painkillers. And a handy thing to have is a drop schedule, which you made up for me, didn't you? So
I did.
Hour 1, I had refresh drops, which are the artificial tears, and the yellow drops. They've got different names, but I thought it best to use them by the colour of the packet that they come in. And purple drops. And then hour 2, refresh. Hour 3, refresh and yellow, and so on and so on. If you make yourself up a schedule, you can't miss anything, because these yellow and purple drops that I had were antibiotic drops, which you need to have. You might also need one of these. A partner in crime to help you administer your drops, and if you're in pain or anything like that, to help you if you can't see properly, or to drive you around. So that's basically what you'll need. And this video doesn't have any scenes of surgery in it at all, no footage of surgery, just my journey, and it's not intended to influence your decision either way. So take a look.
So we're on our way into Manchester, and we're on our way to get your laser eye surgery done at Optimax. So tell me, how are you feeling?
Very nervous and anxious. Extremely.
Now the history of this is that you wanted it doing, didn't you? You were quite interested in having it doing. Why did you want it doing in the first place when you got perfectly good contact lenses and glasses?
Well, I wore contact lenses for a couple of years, and then when I went to have my eyes tested again, you know, normal eye test, I was told that I had enlarged blood vessels around the iris, and that can happen with people who wear contact lenses, because essentially contact lenses cover the eye and don't allow oxygen to get to the eye. The eye absorbs oxygen from the air, so blood vessels were getting enlarged, and although it's not really harmful, I thought I'm not going to wear contact lenses anymore, because I don't. Started wearing glasses again, but I really hate glasses, and there's an element of vanity there as well, you know, so I know I look better without glasses. I don't like having to find my glasses in the morning, sitting on them, losing them, scratching them. It's just really inconvenient, and now I'm working and I can't afford to pay for eye surgery. It's been the longest week of my life. It was a bit sudden. It felt a bit, oh my god, I'm not ready yet. You know, I was planning on it being sort of near Easter.
When you say you're not ready, what would you need to get ready for?
Just mentally prepare myself, really. Okay. But actually I'm glad now that it is so soon, because I've had a week's notice and it's been the longest week of my life because I've thought of nothing else.
Okay. So if we drive, we're about 15 minutes away from parking up. This time in an hour, your consultation will be well underway. What's going through your mind?
Not exactly sure what to expect. Even though my appointment's at 1 o'clock, I don't think the actual surgery will take place till 2:30 or 3. I think there's a lot of things we've got to do first. So I'm not exactly sure what they're going to do to my eyes. Perhaps do the same tests that they did last time. Do new tests, I don't know. But I think there might be a lot of waiting around as well.
Happy, nervous, giddy, excited?
Yeah, all of those. Mostly nervous. I've got my trusty little friend in my bag that the doctor prescribed for me yesterday, so I can be tranquilised.
Cool.
So, must take those about half an hour before surgery.
Cool.
And I can't wear makeup, and I look awful without makeup. I can't wear makeup for 2 more weeks. I can't drive for a week. So some days I have to get the bus to work.
What's your vision like?
A bit hazy.
Yeah.
Yeah. Like looking through a net curtain.
Really?
Mm.
Yeah. Oh.
Tranquilizers didn't work, so I was pretty nervous when this held my hand.
Oh.
And I did kind of like pull away. I was like trying to put my head right through the table. It's like a dentist chair.
Yeah.
So I was like this when he was putting all the equipment in my eyes, and I couldn't resist the urge to blink, and he was saying, just relax, keep calm. Oh, I'm not calm. We did the right eye first, and then he did the left eye. So by the time he came to do the left eye, I knew what was going to happen.
Yeah.
But I couldn't feel anything, but I could see him coming to me.
Yeah.
You know, with the like metal things, you know.
Yeah.
And I could smell the burning.
Mm.
It smelled like burning hair, actually. It wasn't very pleasant. But it's a laser, so I guess that's to be expected. It's burning your skin away, isn't it?
Yeah.
I've got water in the ears because I've been lying down.
Yeah, your eyes have been watered.
My eyes have watered right down to my ears. So I've got to try and resist the urge to dab my eyes dry.
It's really, really important that you don't.
I know.
In fact, it's absolutely crucial to your vision.
I know. I can pretty much see clearly, apart from it being hazy.
Yeah. So what happens now?
So what?
What happens now?
We go home, and evidently I never take tranquilizers ever again because they just don't work. But I've got some sleeping pills for tonight.
Cool.
And then I've got to start putting, I don't know when I've got to start putting the drops in, actually.
You better ask.
Yeah. I don't know whether I've got to start putting them in from later today or start tomorrow or what.
Well, ask that question. You need to be absolutely explicit now in what happens next. Okay?
Yeah. So you heard him shouting at me.
Yeah.
Did you hear me?
Like that's because he's there. But,
got a bit annoyed with you when I was trying, you know, I was pulling away and he was saying, relax, and I can't relax.
Alright, right.
Oh, it feels hot as well.
Does that?
Yeah.
Okay. Go
yeah. Thanks. Sorry I nearly broke your machine. Because after we'd finished those eyes, the first thing I did was put a tissue up to my eye there. Well, not to my eye, but just to the side there. And I hit the machine.
Okay.
Hit the laser machine with my hand. He said, you dropped it into the laser machine. So I said, oh, I'm sorry, I thought you'd finished. So, yeah, it felt hot. I couldn't feel anything because I put anaesthetic drops in.
Yeah.
I could just feel the pressure, but not any pain. But all around the edge of my eyes, not in the middle, just around the edges, feels really hot.
Yeah.